Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe and share. Hello everyone, today we're diving deep into a joint that allows you to do so much, from reaching for the stars to giving a comforting hug. I'm talking about your shoulder. This incredible structure is the most mobile joint in your entire body. It's a fantastic ball and socket joint where the top of your arm bone, the humerus, fits neatly into a shallow socket in your shoulder blade called the glenoid. This design gives you an amazing range of motion, letting you swing, lift, and rotate your arms in almost any direction you can imagine. But with great mobility comes a bit of a trade-off. The shoulder joint isn't as inherently stable as some other joints like your hip. It relies heavily on a complex network of muscles, tendons, and ligaments, collectively known as the rotator cuff and surrounding tissues, to keep everything in place. When these supporting structures are overwhelmed, or if the joint experiences a sudden, forceful impact, things can go wrong, leading to a painful condition we're discussing today: shoulder dislocation. When we talk about a shoulder dislocation, we mean that the ball part of the joint, the head of the humerus, has popped completely out of its socket, the glenoid. The most common type is an anterior dislocation, where the top of your arm bone slips forward, out of the front of the socket. This often happens when your arm is forcefully twisted outward, perhaps during a fall onto an outstretched hand, or a direct blow to the shoulder. So what exactly causes a shoulder to dislocate? The number one culprit is trauma. Think about a sudden, powerful force hitting the shoulder or arm. This could be a hard fall, like tripping and landing awkwardly on your outstretched arm. It could also be a direct blow to the shoulder, something you might experience in contact sports like football or hockey. Car accidents are another significant source of the kind of impact that can easily pop a shoulder out of its socket. Now, how do you know if you've actually dislocated your shoulder? The signs and symptoms are usually pretty hard to ignore. You might even hear or feel a pop or a slipping sensation as the bone comes out of the joint. Beyond the pain, you'll probably notice a visible deformity. You'll also find it incredibly difficult, if not impossible, to move your arm. When you arrive at the doctor's office or emergency room with a suspected shoulder dislocation, the first step is a thorough physical examination. Your doctor will want to hear exactly how the injury happened. The mechanism of injury is a big clue. They'll ask about your symptoms, the type of pain you're feeling, and whether you've dislocated your shoulder before. Then, they will carefully look at your shoulder, checking for any visible deformities, swelling, or bruising. They'll also gently feel around the joint, assessing for tenderness and the position of the humeral head. While a physical exam often strongly suggests a dislocation, imaging tests are essential to confirm the diagnosis and check for any associated injuries. The gold standard here is an X-ray. An X-ray can clearly show if the humeral head is out of the glenoid socket and in which direction it has moved: anterior, posterior, or inferior. In some cases, especially if there's concern about damage to soft tissues like ligaments, tendons, or the labrum, your doctor might order more advanced imaging like a CT scan or MRI. Once a shoulder dislocation is confirmed, the immediate goal is to get that bone back into its socket. This procedure is called a reduction. There are various gentle maneuvers a trained medical professional can use to coax the humeral head back into place. Often you'll be given pain medication or even sedation to help relax your muscles, making the reduction easier and less painful. After the shoulder is successfully reduced, and you'll usually feel immediate pain relief once it's back in, the next step is immobilization. Your arm will typically be placed in a sling or a special shoulder immobilizer to keep the shoulder still and allow the stretched or torn ligaments and joint capsule to begin healing. Once the initial healing phase is over, and the pain and swelling have subsided, rehabilitation is key. This is where physical therapy comes in. A physical therapist will guide you through a program of exercises designed to restore your shoulder's range of motion, rebuild strength in the surrounding muscles, and improve overall joint stability. In some situations, surgery might be necessary, especially if you have recurrent dislocations or significant damage to ligaments, tendons, or the labrum. Surgical procedures can repair torn tissues and tighten the joint capsule to make the shoulder more stable. After surgery, you'll also go through a period of immobilization, followed by a comprehensive rehabilitation program to regain full function and strength. Now let's talk about prevention. One of the best things you can do is to keep your shoulder muscles strong and flexible. Regular exercises that target the rotator cuff muscles and the muscles around your shoulder blade can significantly improve shoulder stability. If you play sports, especially contact sports or those involving repetitive overhead movements, proper technique and conditioning are paramount. Make sure you're using the correct form during your activities to avoid putting undue stress on your shoulder joint. Gradual conditioning to build up the strength and endurance required for your sport is also crucial. Wearing appropriate protective gear, if applicable to your sport, can also help reduce the risk of traumatic injuries that might lead to a dislocation. For those who have experienced a previous dislocation, preventing another one becomes even more critical. Your shoulder might be inherently less stable after the first incident. This is where diligently following through with your prescribed rehabilitation program is so important. General safety awareness can go a long way in preventing falls and other accidents that can lead to shoulder dislocations. Taking good care of your shoulders through strengthening, proper technique, and general caution is an investment in your long-term health and mobility. UMCC, your ultimate medical consultant connectors.